Informs, the largest association for the decision and data sciences, provides the following audio content to journalists for their use in reporting with proper attribution. What follows are 4 questions and responses from Sommer Gentry. At New York University, she's a professor of surgery, a professor of population health, and she's the co-director at the Center for Surgical and Transplant Applied Research, NYU Grossman School of Medicine. She's also a member of the senior staff at the Scientific Registry of Transplant Recipients, and she's a member of Informs. Question 1. What are the biggest challenges America faces right now when it comes to access to organ transplantation?
Well, there are more than 100,000 people who are waiting for an organ, and some people will unfortunately die waiting because there aren't enough organs available from deceased donors and living donors to meet the need. So one of the biggest challenges we face right now is organs that are potentially usable that might not be getting used. And that could have to do with delays in finding the right recipient for a particular organ.
Question 2. How are organs currently allocated to recipients?
Organs right now go to the highest priority recipient who is within a certain distance, say 250 miles or 500 miles of where that organ was recovered. But the OPTN wants to reduce the dependence on geography in order to be more equitable to patients no matter where they live. And so they're designing a continuous allocation score that won't have these fixed boundaries of 250 miles or 500 miles.
Question 3. Where has your work been centered on improving access to organ transplants?
Well, when we design a continuous allocation score that doesn't have any geographic boundaries, we have to include lots of factors like if the person is biologically disadvantaged for an organ because of their blood type or because they are sensitized, if we want to give them extra access to organs because they're a pediatric recipient whose growth is possibly being impacted by this lack of organ function. So in weighing all of those factors together, you end up with a very complicated design problem to choose how to make that one score that combines all of those factors. And I've been working on using a simulation optimization to make sure that score is fair and achieves the goals of distributing organs.
Question 4. How can America improve its access to organ transplantation?
Well, really what's important to a candidate waiting for a transplant is to get that transplant. And so what we could do is align the incentives properly so that hospitals and transplant centers are being evaluated on their ability to get that person across the finish line and get them a transplant, rather than focusing on very small differences in outcomes between different particular types of donors or patients.
Please see the audio content release posted alongside this clip for attributions, soundbite length, and transcriptions. Any other questions can be sent to Ashley Smith, Informs Public Affairs Coordinator, at asmith@informs.org.